Hi, and thanks for coming. We're going to be reviewing how to document on the PCS status board. The PCS status board, or the Patient Care and Safety Status Board, is where all documentation of assessments, care plan information, and education provided to the patient will be documented. To access the status board, select Clinical and then PCS status board. When accessing the status board, you'll be brought to a list of your patients. If you click on the Edit My List, you'll be able to add a new patient to your list. Frequently used buttons are the Add Patient button, which would allow you to search and add a patient to your list. The patient will now be on your work list until the patient has been removed by the user or the patient is discharged from the hospital, regardless of the bed or location the patient is in. By selecting the Add Beds, you would have the ability to add a specific location to your list. And the Cover For option would allow you to pull other staff members' list to your status board to cover for them if you're covering for a break or lunch. We're going to select the Add Patient button and type in our patient's name, last name, comma, first name, and then select Search. You're brought to a list of patients with identifying characteristics. You would merely place a check next to your patient that you're wanting to choose and select the Add button below. This adds the patient to your list or the account selected, and you would have the ability to choose another patient to add to your list at this time by completing the same steps and then selecting Add. Once you've completed adding all of the patients to your list, you would select the Save option. This will add all of the patients to your My List. To remove patients from your list, merely highlight the patient and then select Remove from My List. To review the status board and the different columns it displays, the first column is the Open Chart column. This will allow you to open the patient's chart and then by selecting the status board button, you will close the patient's chart. The second column will display the patient's name, their age and sex, and their room number. The third column will display the account number, the registration status, and if the patient is confidential, a Y will display with a purple background. Any new results will display in the New Results column, backlit in yellow for abnormal, or red for critical. The next interventions due will display. By clicking on the blue sidebar, you have the ability to view all of the next interventions that are due. The next medication or reassessment will display in the next column. By clicking again on the blue sidebar, you would have the ability to see all of the next meds that are due. And the final column will display the transfusion administration record or if the patient has a blood product. The detail box below will appear and display information related to the patient you have highlighted above. It will display the attending provider, the reason for visit, their admission date, current diet with diet information, their last set of vital signs, their skin and fall risk. By selecting the Refresh button below, this will allow you to manually refresh the status board as needed. Let's review the tabs on the right side of the screen. The List button will allow you to look to different locations, either by choosing in any location, selecting the recently accessed charts, returning to your My List, or selecting the Find Account. The status board button will return you to the status board you were last on. The on-call staff button will display a list of providers that are on call for the day. Use the assignments button to change your patient assignment. The clinical data button will be used to review MDRO information and enter allergies and home medications, which we'll review in another session. The manage orders routine is not something that we're utilizing at this time, but it can be used to view, enter, or edit orders, medications, or order sets. The patient reports button will be used to print one or multiple patient reports. This would include the patient's legal record or a 72-hour chart visit. For a full list of reports, you would place a check mark in the additional left-hand column, select the report button below, and then from the drop-down you have the ability to choose from a list of reports that are available. And then select OK. This will allow you to view or print the report. The consent forms and location reports are not things that we are using today. The Open Chart button will allow you to open the patient's chart. And then the status board will allow you to close the patient's chart. The Change Site or Department will display a site or department that you are currently signed into. It would allow you to choose a different site if you need. And the Preferences will allow you to set your manual preferences based on your use of the system. They are set for you already, and once you become more familiar with the system, you'll be able to manage your preferences better. Along the bottom right-hand side of the screen, you'll see some different icons. The question mark icon will be a help screen based on the screen you're currently on. The world symbol is a link or a reference symbol. The printer is a print screen function. The lock symbol is a suspend function, which would allow you to stay logged into the computer, but merely suspend your session while you step away briefly. And the mail symbol is for a future email link. Thank you for joining for our introduction to the status board, and I look forward to seeing you